Thank you very much, Madam Chairman. You heard my opening statement, Ms. Mills, that the thing I get all the time from the businesses is you got to help me on this Obamacare. And what happens if a small businessman walks into an SBA office and says, "Look, Obamacare is killing me. Help me get out from underneath this. I don't have a gaggle of lawyers or accountants to help me. What can I do? Help me get around this." What do you tell them?
Well, let me assure
Toughen up?
Senator, no, that we are very, very active with small businesses and the Affordable Care Act, because access to affordable health care is the #1 concern, as you know, of small businesses all over the country. And their major concern is that they pay 18% more than big companies just because they're small. With the Affordable Care Act, over 96% of small businesses will be exempt from any of the employer responsibility requirements. But there is an opportunity with the marketplaces that are opening this summer for many small businesses to get access to more affordable health care, because there are going to be insurance companies bidding on their business in an open and competitive environment. Right now, if you're a small business and you want to provide health care, you can barely get a quote. Now, if you have an Affordable Care Act marketplace, which will exist in every state, by next fall there will be enrollment, and by next January, small businesses will have the opportunity, not the requirement, but the opportunity to participate and buy their health care on those exchanges.
We're not communicating. Your statement that you said, Senator, you know that the access to quality health care is the #1 concern of small businesses in America. Did I hear you right on that?
That's correct. According to NFIB, since 1987.
Okay. Well, let me tell you that what they tell me is their #1 concern is staying in business, because they can't compete when the government tells them they've got to spend money on something they don't want to spend money on, or they want to spend the money the way they want to spend it and not the way Washington, D.C. and the people who work here tell them they have to do business. And I guess that's what I'm looking for. You know that businesses all over America are trying to get out from under this. They're trying to get away from it. They're trying to get around it. They're not embracing this. You don't see anybody coming up hugging this stack of documents saying, "Look, this is what I want to do." They want to get away from this. So how do you counsel them? How do you tell them, "Look, don't give me this stuff about staying in line to get another health care policy, or I'm going to apply for this"? They say, "Look, I don't want to do it. I don't want anything to do with the federal government telling me what I got to do. Help me out here." Because I get this all the time. Of course, my defense is real easy. I say, I didn't vote for this. No Republican in this institution voted for this. But, it isn't as easy for you since you're part of the administration. What do you tell them?
Well, let's be clear. For over 95% of small businesses, there will be no change. They will not have to provide any different health care or provide health care at all under the Affordable Care Act. One of the issues that we have is that many small businesses don't have good information. And at the SBA, we are aggressively providing information to small businesses, both in person and on our website. So at SBA.gov and at healthcare.gov, we have very clear and detailed explanations of what that a small business can walk through to see what the effect might be and the opportunity might be for them. One of the things that we've seen is many small businesses don't know that they are eligible for a health care tax credit. And one of our jobs is to walk them through their eligibility and see if they are. Any small business that you come to who has these concerns, please send them to our office. We are educated and equipped to walk them through, to provide any kind of service that they need to understand what access and opportunity they might have as a result of this Affordable Care Act.
Well, I appreciate that. And you tell me that you will provide them with any kind of services that they want to help them in this area?
Yes, we have an outreach on information. We are prepared throughout our network. We are educating our entire network because, as you have described, small businesses don't have a lot of capacity to work through and understand things.
So
we will be there for them.
So to be clear, you will help them and counsel them as to how to get around this so they don't have to comply with the requirements that they think that they've got from the federal government. You will help them do that.
Let me be clear. That is not what I said.
Okay. You know, I'm done here. Thank you, Madam Chair.
Thank you.